Hi there, it's Dr. Scott MacLean, and this is a video about tips for success when placing an implant bridge. This case will be an on-one implant bridge, and I'll just tell you a little bit about the history of the case. Basically what happened was the patient came in with a tooth-supported bridge, which was carious. We had to cut that and place two implants, and you can see the two implants there. She came back after these were healing and had broken another tooth right next to this area. So we decided to do a cantilever bridge and to kind of fix this area with just two implants and then place a pontic as a cantilever mesial. If you look at these two analogs in the model, you'll see that the soft tissues look pretty good here. We have a soft tissue model that we've fabricated. But if we start to look at this closer, what you'll notice is that these abutments are actually abutments that have a hex in them. And so the hex itself, if we look really close, we can see it's kind of an engaging type of hex. So if you're going to join two type of implant crowns together, you got to be a little careful when they're both engaging like this. So what we do in this case is to fabricate a non-engaging bridge. And so let's have a closer look at that. Now when you're using a non-engaging bridge like this, the goal is to kind of passively place this in a screw retain position while still maintaining the soft tissue seal at the level of the on-one abutment. So the abutment goes on at time of surgery by the surgeon, and then when you're starting to build the bridge, you're actually working in the junctional epithelium, which is in the soft tissue, so it keeps everything really healthy and all sealed. The other benefit of this abutment system is you end up with less cost because you can use any kind of lab zirconia to fabricate this. And the other component of it is it's super strong because the abutments are so thick at the margin that this zirconia gains strength by the bulk of it, which is like you could drive a truck over this and not cause a problem. And so this is the kind of system you want to have for long-term success, is something strong that seals and protects. We'll remove the healing cap, and these are just caps that are on the on-one abutments. And the on-one abutments are actually staying in the mouth at this point, but we're going to remove the two healing caps and prepare this area for the bridge insertion. So as we unscrew this, the patient should not feel anything at all because we're in the tissue level. So we're not the implant level now. We're at the tissue level. So I want you to stop and have a look at the soft tissues when you see how they're healing on this case, because they are incredible. And just check this out. You can see the tissues on here. This is a patient that's not the best cleaner. She actually has some difficulties with that, but look at the abutments and how nice and clean they are. And the soft tissues get very stable like this with a lack of inflammation, which is conducive to crestal bone stability. And these abutments have been really working well in my hands. We can see when we're doing a bridge, I would really try to get these abutments on because we get a really solid platform shift of soft tissues to seal the implant. You saw how nice the response was in the junctional epithelium. We want really a lack of inflammation, and this is providing that type of system. So you want to have something that's going to cause zero bone loss issues here. So we don't want to have it leaking all the time and having a problem after a number of years. And I've seen that on some cases when you're going to the top of the implant itself, especially if the soft tissues are a bit thin. So this enables you to use the soft tissues to seal as best you can, and I do like that feature. Now looking at the screw, these screws look small, but they are mighty. You can tell that this screw itself is a screw that tightens to 35 newtons, and this is what we want to do when we're putting in this case. And when you place the screw in and tighten it down, you're actually tugging the bridge into the abutment, and so you're tightening it together. And so this is a mechanical type of system which enables this bridge to stay very secure and stay in the position. Now, the position, since it's non-engaging, the two implants hold the position of the bridge based on the two positions of the implants. And so this is kind of why you can be non-engaging on this case. So as we tighten this down, we can see that we're getting to 35 newtons. Look at that. And this is not going to hurt the screw whatsoever. I've played around with these screws, and if you look up the Dallas project on YouTube, you'll see that I did some kind of deformation of screws and tried to see what happened, and it's quite cool, so check that out. And anyway, this screw is really strong. If we look down at the top, it's nice and clean, which is what we want to place the restorations in. And we don't want to get a lot of saliva in those screw channels at this point, so you might want to put some, cotton, like a 2x2. Here we're placing some sterile Teflon. So you take some Teflon, wrap it up in a bag and put it through sterilization. And you can take the Teflon and then tuck it into the channels. And you want to do this just so you can get back to the screws. If you ever had to go in there and take the bridge off, all you do is take the restoration out and go in and get the Teflon. And we used to use cotton, but we're using something different. Now notice the green tip on this restorative material. And when we take this green tip, it's a Filtech 1 bulk fill. And so the green tip is what I want because it actually is the perfect restorative material for a dental implant screw channel. So you can see the channel filling here, which is going to be shown as the screw goes in and we go into this on-one abutment. We're actually holding the universal base down, but this enables us to put the sterile Teflon in, and then we'll put the restoration. Now it's not going to be green, so I'm just showing you green because it kind of shows up on the video. But if we put the bridge together, you can see a bridge, either cantilever or two-ended bridge. We can see that when the restorations go in, they go in like this. So the sterile Teflon's in place, and once we put the restoration in, we can use one of 5 different shades which will match the restoration. And since the channel is actually surrounded by zirconia, these disappear. The handling of this material is excellent. It adapts well, easy to sculpture for fast and easy placement. Typically in these screw channels on implant crowns, they have a large chamber, so you can bulk fill these up to 4 millimeters according to manufacturer, because it's like an occlusal filling. The restorative material comes in 2 formats, in a capsule and also in a syringe. I tend to use the capsule because I find it a lot easier just to dispense this into the mouth and into the screw channel, and so it does make it easy, and that's one thing I like about this product. Now I do like to use the BioClear Heatsink Composite Warmer Kit, or Composite Warmer Kit, wherever you're from. Anyway, this will help it to kind of make the stiffness come down a little bit, and I like that when I'm placing the restoration into the channels to have it a little bit more flowable. There are flowable resins as well, but I like to use this as the main structure throughout the restoration, which works well. So here I'm just shaping it a little bit, and you can see that we get this restoration. You can use the, I call it the finger plugger. So use your finger to kind of shape it. You can also use burnishers. That makes a nice shape on these internal line angles. To bond or not to bond, you could use some Scotch Bond Universal Plus if you so chose, but I just don't usually do this. I just kind of put the material in over top of the Teflon, and this is not going to leak into the implant at all. This is completely in a separate area whatsoever. So the restoration just disappears. You can see, since it's zirconia, it's going to disappear in the zirconia because the color is very universal. So you'll see this is a strong, long-term restoration for the patient, and she didn't flinch when we're putting it in, and that's what I like. It goes in easy and lasts a long time. So this is Dr. Scott MacLean, and this has been a presentation about implant dentistry.